The fight against COVID-19 is far from over in South Dakota. As we've told you, the state isn't expected to peak until mid-June, while the Sioux Falls area, which is where the majority of the cases have been reported, is projected to peak in mid-May. In tonight's Health Beat, KELOLAND's Kelly Volk shows us how what's happening outside of KELOLAND can help in the fight right here at home.
You're probably paying lots of attention to what's happening here at home in the fight against COVID-19. But keeping an eye on what's going on several states away can be helpful for those responding to the pandemic here in KELOLAND.
I think so. I think we would have been silly to not try to learn things from the rest of the country as this virus hit. And I think we've done a good job of learning about what's worked for places like New York City and what hasn't worked in New York City. We've been on calls with people from Seattle to learn what's worked there and what hasn't worked there.
Those parts of the country saw their first COVID-19 cases sooner than South Dakota.
From the original models that we saw when we first started putting together, is affecting less people in New York and less people in California than we expected. It's also less people to be in the hospital and less deaths than we expected. And because of that, I think it's important for us to understand that we believe this is a virus that we as a system and we as a group of people can handle.
But Dr. Cowell says everyone will have to continue following the guidelines.
And as long as we continue to do the right things, we continue to keep our people safe, we continue to respect social distance, we continue to wash our hands, I think this will be something that South Dakota will be able to come through and do well with.
With Health Beat, I'm Kelly Volk.
Dr. Cowell says watching how it worked for other states to lift restrictions will also be helpful here at home.